Hey guys, Dr. Ennis, Boca Raton, Florida. Today we're going to talk about facial surgery in men specifically. So today we're going to talk about facial plastic surgery in men. Again, we talk about men slightly different than women, but the underlying issue is the same. Muscles and ligaments are changing. The underlying structural support of the face is changing, which we have to fix. So very, very easy to get a nice natural result without a pulled look if you understand that we're fixing the muscles and ligaments. Guys are always concerned. Their buddies at the golf course say, "What'd you have done? You look like you had a facelift." Now, it's easy to avoid that, again, fixing the structural part. So let's go through the faces in men and look at different options here. So one of the biggest differences in men and women is how we address the brow. So as we get older, the brow tends to drop down this way. The analogy we often give is a curtain rod or a window. As the curtain rod descends, the curtains begin to puddle at the bottom of the window. So the question is, do we raise the curtain rod? Do we trim the drapes? Do we do a brow lift, or we do an upper lid surgery? So in most women, we want to do a brow lift because we're going to raise the brow back up. That's done endoscopically, 4 little incisions up in the hairline. Now, unfortunately, in men, we tend to have thinning hair. The hairline recedes, and it becomes harder and harder to do a brow lift and avoid the scars. So we do more upper lid surgery or upper blepharoplasties in men. Men also look a little more distinguished if their brow's low, so we can tolerate the brow being much lower. So in men, in the top third, we do more upper blepharoplasties than brow lifts. Now, middle third's a little bit different. In the middle third, there's 3 little fat pads that sit here, and there's a curtain of muscle that hangs in front of the lid. As we get older, the fat gets heavier and the muscle gets tired, just like we do, and that's why people associate this puffiness with being tired. But the same thing happens in men as women, as the malar fat pad or this cheek pad drops down and ends up way down here. As it drops away from the eye, we get some hollowness here, which makes the puffiness look worse, and the marionette lines and nasolabial folds begin to get deeper because everything is dropping this way. So in order to fix the middle third, we make a little tiny incision right up underneath the eyelids. It's almost invisible. Even in guys that don't wear makeup, you don't see the scar. Take out the fat, tighten the muscle, but most importantly, to lift this cheek pad. As we lift the cheek pad, it fills in this groove and gets rid of the nasolabial fold and significantly improves the entire central third of the face. Now, bottom third is a little bit different. So here, 2 things happening. Everything's dropping down. We got to lift everything back up. Never, ever, ever want to pull this way. So when you see some of the actors and people on TV that you say, "Whoa, that looks like a bad facelift," if you look at them, they've taken the skin and pulled the skin really tight. Gravity doesn't work this way. Pulling this way doesn't help. So we've got to lift everything straight back up. So from the neck lift standpoint, a facelift and a neck lift are essentially the same. Both address everything from the nose to the collarbones. Now, men tend to prefer the word neck lift over facelift. I guess maybe facelift has a little bit of a stigma in men, but neck lift is the same thing. Addresses the entire bottom third here. So what we're doing is a deep plane facelift, not the older smash technique, but the new deep plane facelift, where we enter through an incision around the ear and tighten these muscles up, lifting the structural support of the face from here, nicely fixing the nasolabial folds and the jawline without looking pulled. So that's a deep plane facelift, an almost invisible little incision around the ear there. Next is the buccal fat pad. So the last part of this is the buccal fat pad, which is here, easily confused with the jowl. So this is the jowl, this is the buccal fat pad. Now the buccal fat pad starts way up here. The thought is it probably helps us suckle as an infant, but unfortunately over 20, 30, 40 years, it ends up settling all the way down here and adds a lot of weight to the bottom part of the face. An older face tends to be very heavy and square. A young face tends to have more of a V-shaped or heart shape to it. So we're always trying to get all the volume we can out of the bottom part of the face. One of the ways we do that is to take out those buccal fat pads. That's not the little small incision in the mouth, thinning out this portion of the face here. So we now have a much thinner, nicer jawline, thinner lower portion of the face, which is much more indicative of a younger face.